Assalamualaikum warahmatullahi wabarakatuh. We are here to present about medical instrument. We are group 3. The first member is Azzahrah Apriyanti, student number 70. Second member Muhammad Satwiko, student number 18. Third member Muhammad Rizky Putra Nugraha, student number 21. Definition of medical instrument. Medical instrument related with occupational health. Medical device are devices intended to be used for medical purpose. Medical device benefit patient by helping healthcare provides diagnosis and treat patient as well as helping patient cope with illness, improving their quality life. Number 1, medical suite or hazmat. Definition. Health protocol require medical personnel to wear hazmat suit when interacting with patients with certain disease. The word hazmat stands for hazardous material, clothing that can protect against airborne disease. A hazmat suit is a piece of personal protective equipment consisting of a full body waterproof garment worn as protection against hazardous material. Description. Hazmat clothing is made of synthetic fabric covered with a waterproof film, which completely blocks the wear from liquid, vapor, and airflow, and is resistant to damage from caustic and corrosive material. This clothing material is made of polyethylene, which is not easily penetrated by virus. These clothes are usually equipped with a breathing apparatus to ensure the wearer has a supply of air to breathe. This garment is designed for single use and burn immediately after use. Function. Prevent injury from harmful bacteria and corrosive. 2. Reduce the risk of respiratory illness. 3. Protect your body from extreme of heat and cold.
Medical glove. Definition. Disposable medical gloves are used during medical examination and protection to help prevent cross-communication between healthcare work and parties. Medical gloves have little use in chemical and biochemical laboratory. Medical glove protection against corrosive and surface contamination. However, the air easily penetration by sulfate and various harmful chemical and should not be used for using device of text involves checking gloves and in trouble. Description. Medical gloves are made of different polymers including latex, nitrile rubber, polyvinyl chloride, and neoprene. The compound powered with corn start to lubricate the glove, making them easy to put on the hand. Function. 1. To protect hand from dirt. 2. To protect hand from the risk of contamination. 3. To protect hand from spreading germs, bacteria, or virus and transmitted disease. 4. To protect hand against chemical and oil. AE protection. Definition. AE protection covers the AE area to prevent particular infuse to it or chemical from entering the ice. Ice protector covers the ice socket to provide complete protection. They have adjustable and often equipped with ventilation hole to air in and prevent fog. The protective must be safely in the ice area and not easily fog up or interest with vision. Description: A product is made of transparent plastic material that serves to protect the eyes from exposure to virus that enter the body through the eyes. Fungsi 1 to present particle to prevent water. 3 to prevent dust. 4 to prevent gram of chemical from getting into the eyes.
For respirator, a definition. Respirator is a device designed to protect the wearer from breathing in hazardous atmosphere, including fumes, vapors, gases, and particulate matter such as dust and airborne microorganisms. There are two main categories: air purifying respirators, in which breathable in is obtained by filtering the contaminated atmosphere, and air supply respirator, in which an alternative supply of air for breathing is provided. Within each category, different techniques are used to reduce to eliminate harmful airborne contaminants. B description. Respirator have some type of vest covering that is fastened to wearer's head with straps, cloth strap, and other methods. The difference in respirator design has an impact on the respirator protection factor, namely the level of protection resulting from what type of hazard. The respirator contains a respirator cartridge that, that is contaminated with gases and vapors of low toxicity. This cartridge contains adsorbent and active carbon, charcoal, and silicate gel, while the tube is used to absorb chlorine and organic gases of vapors. C. Function. This tool is used to protect breathing from exposure to dust, mist, metal fumes, and harmful gases. 5. Medical marks. A definition. A medical mask, also known as a surgical mask or simple a face mask, is a mask intended to be worn by healthcare workers during surgery and during treatment to contain bacteria contained in droplets and aerosol from the wearer's nose and mouth. These masks are not designed to protect the wearer from inhaling airborne bacteria or viral particles and are less effective than respirators, such as N95 or FFP masks, which provide better protection due to their material shape and tight grip. B. Description. Existing masks are made of various materials such as lightweight cotton, gauze, paper, and synthetic material, some of which are fault resistant. Masks made of cotton or paper are very comfortable but do not retain liquids or are effective as filter. Masks made on synthetic material can provide protection from large particle droplets that are spread by coughing and sneezing to people who are near the patient. However, even the best surgical masks are not designed to fit snugly enough to prevent air leakage at the edges. Thus, masks cannot effectively filter the inhaled air and cannot be recommended for this purpose. The function. Masks that are used to contain splashes that come out when a healthcare worker to surgeon speaks, choke and sneezes, and to prevent splashes of blood on or other body fluids from entering the nose or mouth of a healthcare worker. If the mask is not made of a liquid resistant material, then the mask is not effective in preventing these two things. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.